Chapter 7, the Cardiovascular and Lymphatic System. In this chapter, we're going to look at defining the functions of the cardiovascular and lymphatic system, identify and describe the structures and functions of the heart, list pathogenic conditions and common laboratory tests associated with the cardiovascular and lymphatic system, trace the flow of blood through the cardiovascular system, define different types of blood vessels and properties, identify and describe the cellular and non-cellular components of blood, the difference and similarities between whole blood, serum, and plasma, and locate and name the veins most commonly used for phlebotomy procedures, as well as define homeostasis and describe the basic process of coagulation. So the cardiovascular system's function is to transport water, nutrients, electrolytes, hormones, enzymes, antibodies, cells, and gases to all the cells of the body. It also acts and functions in defense and coagulation process. Please review Table 7.1 in your textbook as it goes over the organ structures and primary functions of each. The heart is a muscular organ the size of a fist, located left of the midline and the thoracic cavity. It has 4 chambers, 2 atria and 2 ventricles. So the atria are on top, the ventricles are on the bottom. Separated by the intraocular and intraventricular septum wall. Valves positioned between each atrium and ventricle, so blood flow is only one direction, preventing backflow, as shown here. The cardiac cycle refers to one complete contraction and relaxation or pump or heartbeat. Many processes happen during each beat, and 2 circuits or pathways are significant. There is the pulmonary circuit and the systemic circuit, which we will review. The pulmonary circuit, blood flows from the heart to the lungs and back to the heart again. This carries blood with low oxygen away from the heart to the lungs to get oxygen, and then back to the heart again via the right and left pulmonary arteries. They will come back into the heart via the left and right pulmonary veins. The difference in color shows you whether it is oxygenated or not. So as it leaves the heart and goes out to the lungs, it's deoxygenated. When it comes back from the lungs to the heart, it is now oxygenated, represented by the color image shown. The systemic circuit is oxygen-rich blood flow to all regions of the body except the lungs. It carries blood away from the heart through the aorta to all parts of the body. So blood flow begins in the right atrium of the heart and receives blood from 2 large veins, the superior and inferior vena cava. The superior vena cava brings blood from the head, neck, arms, and chest, and the inferior vena cava carries blood from the rest of the trunk and the legs. It's really important to understand that this is O2 poor blood from 2 large veins, and we go from the top of the head to the bottom just because of, depending upon how tall someone is, it's essential to keep balance. So blood flow through the heart is shown in your text on page 219. When blood enters the right atrium, it passes through the right atrioventricular tricuspid valve into the right ventricle. When blood exits the right ventricle, it begins the pulmonary circuit to the right and left lung arteries. The breakdown of the blood flow, as shown in this chart on page 219, 1 through 6 is what you will need to know for basic overview of the flow. Once in the pulmonary circuit, it carries deoxygenated blood. Vessels branch into smaller arterioles and capillaries within the lungs where gas exchange occurs. O2 is picked up, or oxygen, and CO2, or carbon dioxide, is released From the respiratory capillaries, blood flows into the right and left pulmonary veins and then into the left atrium. It's really important that we know where blood flow starts and where it ends. In the pulmonary circuit, blood flows through the mitral valve into the left ventricle. Blood exits the left ventricle, passes through the aortic semilunar valve and into the ascending aorta to the systemic circuit. And in the systemic circuit, this carries blood to the tissues of the body. So the heart's function is to pump sufficient amounts of blood to all cells of the body by contraction systole and relaxation diastole. Blood pressure is a force of blood pushing against the walls of the blood vessels. So as shown here, normal blood pressure, narrowing blood vessels could cause high blood pressure because you're pushing something from a smaller surface area, and at a normal pressure would cause the blood pressure to go up. Heart's function, the average heart beats is 60 to 80 times per minute. The heart rate is your pulse. It's measured by feeling a pulse and counting the pulses per minute. Heart rate responses are designed to maintain the body's homeostasis. And if you look on page 221, it describes the gas exchange in the systemic and pulmonary capillaries, which is just essential to just review. Next, we're going to go over, before we start the blood vessels, I want you to review on page 222 irregularities in the heartbeat pattern. So an arrhythmia is irregularities in the heartbeat pattern, pulse, or rhythm. A slow rate is bradycardia, fast rate is tachycardia, and rapid irregular rhythm is called AFib or atrial fibrillation. Please note that children have faster heart rates than adults, and highly trained athletes have slower rates because of more blood can be pumped with each beat. So just being aware of that. We're going to continue on to the blood vessels, arteries, veins, and capillaries next. Arteries carry blood from the heart. Veins carry blood toward the heart. And our capillary network is kind of where the venules, arterioles intermesh into a thin network here. So arteries are highly oxygenated vessels that carry blood away from the heart. They branch into smaller vessels called arterioles and into capillaries. Their appearance is bright red in color, and they're oxygen-rich, having thicker elastic walls, and they have a pulse. Because of the amount of pressure, this is why the thicker walls are essential. Veins carry blood toward the heart. All veins, except the pulmonary veins, carry deoxygenated blood. They have thinner walls than arteries, and veins in the antecubital area of the forearm are most commonly used for venipuncture. Please be aware of item number 2. This is the exception. The pulmonary veins carry oxygenated blood because they're bringing oxygen from the lungs back into the heart. Veins appear bluish in color under the skin. They have thinner walls than arteries, and the patterns differ significantly, as shown here. So veins, and I'm going to kind of blow up this image here. So in arteries, tuca media, which is like the inner muscle layer, and an artery is much thicker because of the amount of pressure. It is smaller in a vein. Veins have valves, arteries do not. The valves work so that blood flows in one direction. With the pressure for the artery, it's not necessary to have these valves. The lumen is the hollow portion inside the artery or the vein. They then branch off into arterioles and venules and then kind of connect in that capillary gas exchange network. The tuca exterior, as shown here, is a little thinner in an artery, but it's the tuca media that's the most important when it comes to the understanding the size. So if we look at some of the similarities and differences, so arteries have thicker walls to resist the strong pressure of blood being pushed through, where veins have thinner walls than arteries. They're most likely to collapse when blood is withdrawn, and capillaries if you look here, the walls have a permanent exchange of blood and fluid from the surrounding tissue, so they're smaller in diameter to allow only one red blood cell to pass through at a time. So if you notice between the different categories, the capillaries only have the endothelium and basement membrane because we need to allow for that gas exchange. This is just some images, and this is a chart that I pulled from various images represented on page 227 through 229 in your textbook. And they are just the venous system of the upper torso, the lower legs, and the arms. Capillaries are microscopic vessels linking arterioles and venules. May be so small in diameter as to allow only one blood cell to pass through at a time, and they allow for gas exchange, fluids, and other molecules between blood and the tissues. And generally, capillaries, this is where we would obtain a finger stick or heel stick procedure. We would get capillary blood from this. Please reference on page 227 the common veins that are found in the arm. We will be covering this. The antecubital area around the bend of the forearm is most commonly used for venipuncture. We have the median cubital vein, the cephalic vein, and the basilic vein, and I will point these out in an image. Arterial characteristics of external bleeding is bright red, quick spurts, harder to control bleeding. Venous is dark red, steady flow, steps bleeding with gentle pressure, and capillary is slow blood, slow and even, steps easily with slight pressure. See tables 7-2 in your textbook for reference. So we're going to kind of look at blood volume here. In just a second, I want to go back to the image of the arms and veins to kind of blow up this image a little bit more so you can see. So here. So there is veins in the arms, median cubital located in the middle of the arm. Basilic would be located, generally the basilic vein is going to be on our pinky side closest to the inner part of the body, and cephalic vein would be on our thumb side if our arm was facing up, which is located on the outer portion of our arm. How we remember this is if you were to look at your arm, basement being the bottom of the house, median meaning the middle or middle of the house, and then C is our ceiling, which is top. Is kind of a way to describe it. The median cubital is our first choice. It's less risky. It's located in the middle of our arm. Cephalic would be second, and basilic would be last. And the reason why the basilic vein is drawn last is because of its location and proximity to the basilic artery and nerve. So it is also really essential that we utilize those veins in those fashions. Every arm is going to be different in a different representation of the veins. We will have a detailed lab on tourniquets and vein selection in your lab class as well. Okay, so blood volume. If we look on page 231, blood volume is really dependent. Human bodies contain approximately 5 quarts of whole blood, which is composed of water, solutes, and cells. The volume of blood is an individual varies according to body weight. For instance, an adult men usually have about 5 to 6 liters of whole blood, where an adult woman usually has about 4 to 5 liters. So when we equate this, we kind of look at volume. So a 9-pound newborn has about a 12-ounce can of soft drink. A 60-pound child has 1 2-liter bottle, and a 125-pound adult would have equals about 2 2-liter bottles of a soft drink. And again, this is dependent upon body weight. Whole blood is normally composed approximately of 3 quarts, or about 50 to 60% of plasma, and 2 quarts of cells. And again, we just reviewed this in the last slide. Blood specimens will coagulate and clot immediately when removed from the body because that's a natural process of coagulation. Plasma is the liquid portion of blood and lymph. It's composed of water and solutes, proteins. Cellular portion, white blood cells, platelets, and red blood cells. It's a thin fluid. Plasma is straw-colored. It's yellow. In conjunction with electrolytes, proteins help buffer the blood, and buffering is the body's ability to control the pH of the blood. Basic functions of the blood on Table 7/2, function and specific action, is really good to review as well. If we view this image on page 232, we're going to look at the various components of the blood. So plasma, 55%, is made up of water, a solvent for carrying other substances, salts and electrolytes, plasma proteins such as albumin, fibrinogen, globulins, and it maintains its major function is to maintain the body's water, clotting blood, and defense. And then we have substances transported by the blood such as nutrients, vitamins, waste, respiratory gases, and hormones. So the formed elements make up the additional 45%, which is going to be our erythrocytes or red blood cells. We have about 4 to 6 million, and they transport oxygen and help transport carbon dioxide. Their lifespan is 120 days. Leukocytes are white blood cells. We have about 4,000 to 11,000, defense and immunity, and their lifespan is 1 to 1 year. These cells we will review in a little bit is the 5 different white blood cells that can be present in our body. Platelets, we have 250,000 to 500,000, and they aid in blood clotting. Their lifespan is 9 to 12 days. So when we get this from a patient, the plasma is this liquid portion, and the cellular type or formed elements is the actual blood. Okay, so I'm going to reference you to your textbook, and we'll describe this picture here. So serum, if the blood specimen is allowed to clot, the resulting liquid portion is serum, plus the blood cells meshed in a fibrin clot. The same chemical constitute as plasma, except clotting factor fibrinogen and the blood cells are contained in the fibrin clot. So as your book describes it, we'll look over this image. So this is a tube with an anticoagulant. An anticoagulant prevents the blood from clotting. This tube does not have an anticoagulant, which would allow the blood to clot. So as shown here in this image, it contains an anticoagulant. Its unclotted cellular components collected at the bottom. So this straw liquid portion is plasma, contains the fibrinogen. Then there is a buffy coat, which is white blood cells and the platelets, and then red blood cells would be on the bottom. A serum specimen does not contain an anticoagulant, so cellular components form a clot at the bottom of the tube, and the liquid portion is referred to as serum, is clear or straw. So serum minus the clotting elements, serum gel barrier, and then the clot and blood cells in the fibrin clot are represented at the bottom. This is what distinguishes the difference between a serum and plasma sample. It's primarily based on the anticoagulant present or not present in the test tube. So the blood is electrolytes, or I apologize. Erythrocytes, red blood cells. Their bioconcave disc shape, flexible shape allows passage through narrow capillaries and provides maximum surface area for O2 and CO2 exchange. Lifespan is approximately 120 days in the circulating blood. The red blood cells. Failure of bone marrow to function properly may result in anemia, a deficiency in red blood cells or hemoglobin. The body's not making enough red blood cells, and bleeding causes too much blood loss, and the destruction of red blood cells occur. So when we look at this, we're going to look at the ABO blood group system. So there's 4 blood types. There's AB, AB, and or O. Type O is the most common type, followed by A, B, and AB. Difference in blood types are due to the presence and absence of protein molecules called antigens and antibodies. So the universal donor, person that can give to every group, is O. The universal recipient, the person that can receive from everybody, is AB. Please be aware that patients will get cross-typed and matched prior to surgeries to make sure that they have compatible blood types. Type AB, blood universal donor of plasma and universal recipient of the cells. Type O is a universal donor of red blood cells only. And then there's the Rh factor. So the Rh positive individual has antigens for Rh factor on the red cells, and Rh negative people do not. So in this image, the patient has type A blood, surface antigen B. They have type B blood, as shown here. They are exposed to anti-B antibodies, which is on type A blood. When there is a compatibility that is not matched correctly, agglutination or clumping occurs, and then hemostasis, which is the breaking apart of the red blood cells, which can cause some serious transfusion reactions. And the hemostasis actually causes the red blood cells to break apart. For blood transfusions to be successful, both ABO and Rh blood groups of the donor and recipients must be compatible, and it's accomplished by cross-matching donors and recipients' blood for compatibility. Blood transfusions can be life-saving procedures. If a patient or donor is misidentified, serious complications may result: round transfusion, hemolysis, agglutination, organ damage, or death. Please see Table 7/3 in your textbook. We're going to continue with the blood, looking at the leukocytes, white blood cells. 2 groups differ in color, size, shape, and nuclear formation. There's granules in the cytoplasm, and agranular, without the cytoplasm granules. This is part of the body's defense mechanism, and the cells go through phagocytosis, ingestion of a pathogenic microorganism. They're formed in the bone marrow and lymphatic tissues, and there's 5 different types: neutrophils, basophils, eosinophils, lymphocytes, and monocytes, each taking a different part and representation. So when they're looking, they're going to look initially at the patient's white blood cell count. Is it elevated or not? If it's elevated, they're going to ask for a differential, and the differential is distinguishing how many of these cells are present. If we notice the patient has a lot of neutrophils, it might actually show the physician that they are having an immune defense. If there's a lot of eosinophils, it might be defense against a parasite. If there's a lot of basophils present, this can show an inflammatory response. If there's a lot of monocytes, again, an immune defense, and lymphocytes, an antibody production cellular immune response. So being aware of this will help aid the physician in diagnosing their patient appropriately. So thrombocytes are platelets. They're smaller than any other blood cells. They help in clotting process by forming a temporary patch or plug to slow blood loss and contracting after the blood clot has been formed. Their lifespan is 9 to 12 days. So hemostasis is a complex process that allows the body to control bleeding while still maintaining circulating blood in the liquid state. It enables the body to retain blood in a vascular system by preventing blood loss. There is videos inside the Blackboard shell under Chapter 7 that you can view that will go over this in a more visual detail. So the phases in the clotting response. So the phases in the clotting response go as follows. There's a vascular vasoconstriction. So when the body is introduced to a cut, the body's first reaction is it's going to want to spasm and it's going to recognize the rupture in the epithelium and try to repair it. So this is where it's going to try to contract and relax to get that injury closed. If it cannot get the injury closed, we're going to go to the platelet phase. And platelets are then released, fibrin, and begin to try to seal the skin. If that does not work and we still see red blood cells passing through, we're going to go on to the next phase, which is the coagulation phase. This is the release of clotting factors are formed to help form a clot. This can be represented on page 244 in your textbook. So this is the introduction of platelet factors, calcium, clotting factors, and platelet thromboplastin. These factors will clump together over the red blood cells and platelets to try to, again, create a patch over the cut. Then there's clot retraction. This is where the vessel has started to not let blood leak out anymore, and it's starting to pull that tear back together. And then fibrinousness, the vessel is repaired and the clot begins to dissolve. It's really essential that to make note in figure 7/26 that calcium ions, vitamin K, and phospholipids are vitally needed in the body to synthesize and or activate many of the clotting factors, calcium being the most important. And this is just figure 725 in your textbook, as well as 726, which breaks down the clotting process. Okay, so to review and recap this, we're going to go ahead and look at the page 243. We have the vascular phase. Once a blood vessel is injured, a rapid constriction of the vessel decreases the blood flow to the surrounding vascular bed. Then the platelet phase clumps together and adheres to the injured vessel in order to form a plug, inhibiting bleeding. Coagulation phase. Many specific coagulation factors, clotting factors, and calcium are released and interact to form a fibrin meshwork or blood clot. This clot seals off the damaged portion of the vessel. Then we have the clot retraction. This occurs when the bleeding is stopped and the entire clot retracts to heal torn edges by bringing them closer together. And then we have clot destruction or fibrinousness, when the final repair and regeneration of the injured vessel occurs. The clot slowly begins to break up, dissolve, and other cells carry out further repair. The entire process is fast. Hemostasis and coagulation phases in the clotting response. All coagulation factors are required for the intrinsic system contained in the blood, and the extrinsic factors stimulated when the tissue damage initially occurs. Disorders of the cardiovascular system and hemostatic process. This can be found on table 7/6. Please also review the clinical alert on 245. Congestive heart failure, AFib, and valve problems. Vessel problems would include arteriosclerosis, cerebrovascular accident or CVA or stroke, ischemia. An aneurysm is a weakening of the blood vessel wall, which causes a balloon to form and rupture, and then also hemorrhage. Your book goes into great detail about these disorders in the description, so please make sure to review these in your own time. Some disorders of the blood: polycythemia, anemia, septicemia, leukemia, leukocytosis, and leukopenia. So these are also represented in your textbook. Please be aware that septicemia is a bacterial infection of the bloodstream and can lead to more serious conditions involving sepsis. Where leukemia, usually classified as bone marrow cancer, in which excessive immature white blood cells are produced and not fully function properly to help fight infection. So hemostasis problems, including deep vein thrombosis, hemophilia, embolus, thrombocytopenia, thrombus, and DIC or disseminated intravascular coagulation. Please see Table 7.7 in your textbook. An embolus, just so you're aware, is a blood clot that travels. Hemophilia is where the patient lacks clotting factors, so they cannot form a clot and they tend to bleed very easily. Just to give you a difference in the terms. Some common tests. So in departments, hematology performs tests on red blood cells, number, morphology, hemoglobin content, morphology and number of platelets and white blood cells, where the coagulation lab's primary function is platelet function, coagulation factors. Immunology or blood banking, they do blood typing and cross-matching. Clinical chemistry is our biggest component in the lab. They do serum and plasma constitutes. Lymphatic system components in the lymphatic system include our lymphocytes, lymph vessels, lymph nodes, tonsils, spleen, bone marrow, and thymus glands. They're closely interrelated connection with the cardiovascular system. They maintain fluid balance in the tissues by filtration. They act in defense and immunity against disease, and they distribute nutrients, hormones into the bloodstream, remove waste, and absorb fats and other substances. The lymphatic system has approximately 30 liters of lymph fluid pass from blood to tissue space each day. If more than 3 liters are retained in the body's tissue instead of the bloodstream, edema or swelling could result. These are some disorders. So lymphoma and Hodgkin's disease, immune disorders, and infectious processes. Lymphatic system laboratory tests, so blood samples. We also perform on bone marrow. Lymph nodes are often surgically removed or aspirated so the cells can be analyzed, and or cultures are performed in the analysis of markers on the surface of the cellular material. Please see Table 7.8 in your textbook, which goes over medical terms and definitions as it relates to the cardiovascular and lymphatic system. Please be aware that in the lymphatic system, this is where it's really essential that when a patient, for example, has lymph nodes taken out post mastectomy, so removal of the breast, that we can no longer draw that arm. It doesn't matter if it's been 5 years, 10 years, 50 years, regardless. So because of the function of lymph nodes in removing waste, they maintain fluid balance in tissues by filtering the blood and lymph fluids. They provide defense. When those lymph nodes are not present, they don't do these functions anymore. So when a patient has a mastectomy, we got to be very mindful of this. So this means putting no pressure or needles into that arm, because if we were to give the patient an infection, they may not be able to get rid of it, and they could also have edema in that arm or lymphedema. So it's really essential that we get that history from the patient, and why we ask the patient, do you have an arm preference? Because then that engages the patient to express if they've had that procedure done, because you would not know in normal circumstances. So just being aware of these systems kind of overlapping each other and why it's essential we need to know about both. This concludes Chapter 7's narrated lecture PowerPoint. Please make sure to review again in summary the clotting phases. You'll need to know all 5 and what's occurring in each phase. Also being aware of the essential calcium ions, vitamin K, and phospholipids are needed in order to activate clotting factors as well in this chapter, and knowing your blood flow of the heart is really, really essential. So there's a lot of overview. We will provide a study guide. Please make sure at the end of the chapter to review any of these study questions, case studies, and actions in practice. And again, for this, going over the competency checklist on 255, knowing the major structures, functions, examples of laboratory tests, and examples of disorders as it relates to the cardiovascular system, and going over the key terms, which is really essential in helping you prepare for your test.